Welcome to another edition of Inside Medicine. I'm your host, Doug Geinzer, the CEO of Las Vegas Heals, and we are here in the studio today with Maurice Maharaj and Dr. Snyder of SimonMed. So for those of you that are new to Inside Medicine, we broadcast live in the studio every Thursday at 10 o'clock, and you can also catch us on our Facebook page, as well as vegasvideonetwork.com/live. We try to bring together the leaders of healthcare here in the Southern Nevada community, talk about great things that are happening in the advancement of healthcare, new technologies that are brought into town, medical education, medical tourism, and all things medical. Today, we're going to learn a lot about SimonMed, and I think they touch on all of the subjects that we just talked about. Gentlemen, welcome to the studio.
Thank you. Thank you.
Thanks for having us.
Yeah, so if you don't mind, before we get started, let's get to know you guys a little bit. Tell us a little bit about yourself, Maurice. What brought you to Las Vegas? What got you involved with SimonMed? Where do you come from? Let the audience know a little bit about you.
Oh, there's a long story behind it, but I'll give you the short version. I started with SimonMed about 8 years ago in Phoenix, Arizona. We had about 16 locations in SimonMed, and I ran one of the locations down there. Right now, that location is probably one of the top producing locations that we have in the entire nation. When I started with SimonMed, Dr. Simon used to come around every single day to all the sites to visit us to make sure we're doing okay, ask us a whole bunch of questions. How I got to Las Vegas about a year ago when we opened up here, Dr. Simon needed someone up here from the corporate office to really run and make sure we're doing things and sending the right message here in Las Vegas. So my wife and I moved out here, and here we are a year and 2 months now, and really enjoy here Las Vegas a lot and learning the community and learning the healthcare community, which is a very tight-knit community.
Yeah. Well, welcome to Vegas. You moved from one part of the desert to the next part of the desert.
Yep.
Hopefully we're a degree or two cooler than Phoenix.
That's what I tell people all the time. I moved to a cooler climate.
There you go. Dr. Travis Snyder, you are somewhat of a local. You went to college here or went to med school here in Las Vegas. Tell us a little bit about yourself, your background, and what brought you to SimonMed.
Yeah, so I went to medical school here at Toro University in Henderson, and then I did a radiology residency in Michigan State, and then I did a Neuro Radiology fellowship in Miami, University of Miami and Jackson Hospital. And then because of my connections to the community here, I came back to Las Vegas, and then I've been working with SimonMed for probably 2.5 years now.
These are the stories that we love to hear. As you know, we've got dire shortages in all areas of healthcare, and to be able to attract practitioners such as yourself, highly qualified, to come back here. So going to Toro, so what got you excited when you're at Toro? I do a lot of work with Toro. They're one of our biggest supporters of Las Vegas Heals. What struck you an interest in coming back to Las Vegas?
Oh, I didn't know that they were such a supporter. I mean, it's a great school. They do a lot for the community. I have so many classmates of mine that work here in town. Great physicians. They refer to us because they know me.
Sure.
They have my cell phone number. The same with a lot of referrings. I have a lot of the cell phone numbers of various doctors in the region. So if there's a problem, very sick patient or something that's very urgent, patient needs to go to the emergency room, I just call the doctor directly, right after if I have their number. Yeah, it's a great school, and I think that I work a lot with the students. This summer I have about 15 students that are doing research projects.
Oh, right on.
With SimonMed, and on advanced brain imaging for head trauma mostly.
Yep.
Also carbon monoxide poisoning. There's case reports where I'm very focused on research, and we have some exciting papers coming out.
That's awesome. I love hearing stories about what brought people back to Las Vegas, because Las Vegas Heals was deeply involved in the expansion of graduate medical education. Right. And 67% of doctors will stay where they do residency. And so we're trying to figure out, how do we get that number a little bit higher, and those that leave, because Toro's most recent class, I think only 32 of them are staying in Las Vegas for residency. How do we capture the other a little under 100 to come back after? So I want to talk to you a little bit later about what brought you back.
It's a tough, it's complex, and it's a tough question, but yeah, we'll talk.
Yeah, absolutely. So I want to learn a little bit more about SimonMed, your mission, right, what brought you here. There's a big story behind SimonMed. Tell us a little bit about the background and the mission and the purpose.
Yeah, absolutely. So SimonMed started in 2003 in Scottsdale, Arizona, by Dr. John Simon. When we got to Las Vegas about 2.5 years ago, and we currently have about over 100 sites throughout the nation.
Wow.
So we have a big national presence within the United States. SimonMed is a national leader for radiology, outpatient radiology, and we're probably one of the largest outpatient radiology companies in the nation right now. We offer advanced imaging for low costs.
Yep.
With great technology, subspecialty rads like Dr. Snyder, Neuro Radiologist, and convenient locations here in the Valley for our patients. We employ highly trained medical staff, making sure that they're dedicated to our patient care. That's really important to us, our patient care. We should expect very quality reports from all of our radiologists, and also that SimonMed is a company that's going to work with our referring providers, our patients, to make sure they're getting the best experience and the best quality imaging that they can.
How many centers do you have here in
right
Las
now? We
Vegas?
have about 7 centers, and
Oh,
we're
wow.
looking to expand in the next year or two to even more. Our model is to make sure that we're conveniently location for the patients.
Yep.
Right now, it's so hard for patients to get to these locations because they're so sporadic throughout the Valley. So we want to make sure and put them in the right areas for our patients and making it convenient for the patients. This helps the referring providers because that continuum of care, making sure the patients follow up with their exams, getting it same day, next day is extremely important.
Yeah, well, we all like to seek care close to home.
Yeah, yes.
So you started in Phoenix.
Yeah.
With one center. How many centers are in Phoenix now? You got over 100
Oh gosh,
around the country. How many are in Phoenix, and what other areas are you serving?
I want to say we have over 55 to 60 locations in Phoenix right now.
That's big.
And that's serving about 4.5 million people. Here in Las Vegas, we're at like 7 centers, and there's about 2.2 million people here in Clark County. We have Florida, and Orlando and Tampa, and Northern California, Southern California, Colorado, and we're looking at other states.
Relocation destinations.
Yeah.
That's what we call
Keep
places
it
where
warm.
people want to be.
Yeah.
Not out of the Rust Belt where we're both from, where people try to move from. Very good. So I think I saw a video that I'm going to have Nick, our producer, play for us. It really dives deep into the mission of SimonMed and allows Dr. Simon to give that. So Nick, if you could cue that video up, please.
Thank you.
Patient care and the satisfaction of our employees goes hand in hand.
One of the most amazing things for me is what we do for our community.
What I love most about my job is being able to serve the community, to take care of people.
My most rewarding part of the job is just educating the patients in any aspect that they need.
So you have to remember and you have to put yourself in that patient's position and just be as professional but as kind as you can, because that could be your mother, that could be your sister, that could be your daughter.
You know, we'll be at an event. Patients will come up and basically tell you that SimonMed caught their cancer early, that SimonMed saved their life.
What a great video. You know, a lot of people don't realize how important radiology is until you need it. And when you need it right then and there. So what separates SimonMed from some of the others? What makes you different?
You know, there are a couple of things that make us different. I think the number one thing that I would put out there is our customer service, how we are very customer service oriented. You know, as you saw from the video, we take pride in making sure that our patients are taken care of and they are communicated to and making sure that they know what they're going through. You know, people come to radiology and it's their first time doing a CT scan, MRI, or nuclear medicine. They don't know what's happening. So our staff is very keen on that, making sure that we're explaining the exams, making sure that they feel comfortable, and make sure when they leave there, they're coming in and we're offsetting their nervousness and bringing them out, making sure they get good quality. We have 7 convenient locations throughout the Valley. It's important, like I said earlier, to have those locations throughout the Valley. Subspecialty trained rads, such as Dr. Snyder, here, a Neuro Radiologist. Very important for us to have subspecialty trained rads, whether it's MSK, pediatric, Neuro Radiology. All of those are important to make sure that the patients know when they come to SimonMed, they're getting a quality read from a quality radiologist. Low cash prices for our patients who don't have insurance. I think there's a big part of the population that they just can't afford insurance, and so we try to mitigate that by offering the lowest cash prices here in the Valley. Complimentary transportation for all of our patients when needed.
That's important.
Yeah,
that's a barrier to care.
Yeah. You know, I don't like taking the bus in the middle of summer at 110 degrees. So us sending a complimentary transportation to our patients really helps them make sure they're getting their exams done. And
so are all the vehicles wrapped in the SimonMed? I love your vehicle.
Yeah, we have a couple pink ones. Yeah, you know, we really focus a lot too on breast cancer awareness. So, and we'll talk a little bit about it a little later. A couple of things I think that is important to us is the same day, next day appointments.
Yep.
You know, patients have to wait 2 and 3 weeks to be able to get in some cases. At SimonMed, we strive to make sure getting those patients in right away, whether it's that same day or next day. Barring any insurance issues or anything like that, we get our patients in right away. We may not be able to get you in right next to the one right by your house, but we'll get you in somewhere, and that's what we strive to do.
And it means the radiologists sometimes have to stay late, but,
Yeah.
but that's okay.
That's okay. Hey, we do what we have to do. We are a national company, Doug, and with that comes the benefit of utilizing from our different areas any advanced technology that they have come across, and we share it with all of our regions, making sure that we're bringing the best to Las Vegas and taking it from other regions and bringing the best to Las Vegas too. That's what we're trying to do here in Las Vegas. Bring another option for patients and providers, but bring quality to Las Vegas.
That's awesome. Dr. Snyder, you're a subspecialist. Do you float between all of the facilities? Are you located in one, and do the patients come to you at one facility? Because I imagine some of that's got to be equipment or magnet driven. I don't know.
Yes. So I'm mostly in the Summerlin area. We have there's 5 or 6 radiologists that work for SimonMed here in town, all local. And mostly I'm in the Summerlin region and covering contrast in case a patient has a reaction. We want to have a radiologist on site in case there's which I've actually never really seen that since I've been here. We've never had a problem. But and also I do procedures, so we do arthrograms and other types of procedures, so I have to be at the centers for that.
So you guys really have a lot of subspecialists. You focus on that higher level quality of care.
Absolutely.
That's cool. So talk a little bit about the advanced benefits, because a lot of it comes down to the equipment, to the magnets, to really, you've got some of the best equipment out there. Talk a little bit about that.
Absolutely. I'm going to talk about from my own experience. I'm mildly claustrophobic when it comes to MRIs. So we have a couple machines at SimonMed that are wide bore MRI machines. These are 3T MRI machines, 3T meaning the strength of the magnet. It's the highest level right now out in diagnostic radiology, utilized for imaging for MRIs. The circumference or the diameter of that particular machine is a lot bigger than your typical MRI machine. A matter of fact, you could fit maybe 2 of me in one of those machines. A big, maybe NFL player could fit in one of those machines. So for patients that have that fear of coming in for claustrophobia, not being able to go into that MRI tube, that one's a CT, but it's as big as that.
Yeah.
It makes it a lot more comfortable experience for them. When it comes to patients that are grossly claustrophobic, we have the stand-up MRI. And that's a twofold machine. It helps us utilize weight-bearing MRIs for patients doctors that want to see their patients in a weight-bearing position, and also patients that are grossly claustrophobic. It's wide open. They can get in there, and there's nothing in front of them except a TV, watching a TV. So that's really, really good. When it comes to our CT machines, we have about 5 different CT machines. 2 or 3 of them are 128 slice CTs. But what's the biggest differentiator of all of that is the fact that we utilize software to help us lower the radiation dose. With CTs, I always consider a CT X-ray on steroids. So they put out a lot of radiation. What Dr. Simon has afforded us to do with this software is bring that dose, that radiation dose, down up to 80% in some cases when doing a CT scan. CT scans are very quick, but they put out a lot of radiation. One of the things that we focus too on is our breast imaging. We have 3D mammogram machines at all of the sites that we do mammogram. On top of that, we have something called a automated breast volume scanner. And this is utilized for patients with dense breasts. This is more of a screening, a 3D screening ultrasound for patients that want to go that extra step. As a matter of fact, we run specials on that all the time. You get your mammogram at SimonMed, you get that done for free too as well.
Yep.
So we do offer free screening mammograms through the Breast Cancer Awareness Month, October. And last May, we partnered up with Coleman, and we did the same for the month of May, free screening mammograms for patients who can't afford it, patients who don't have insurance, just don't have the means. So it's important to us. A couple other things that we have, Dr. Snyder could probably talk a little deeper about, was a DAT scan and DAT quant and a lesion quant and neuro quant.
I look at these words and they confuse me. So Doc, can you give us like the lowest version here? We all like to speak in a 4th grade vocabulary level. So what does that mean?
Sure. Well, I mean, maybe I should expand a little bit on what Maurice was saying about the difference between us and our competitors first. And So one of the reasons that I joined SimonMed and what the benefits I think of SimonMed as compared to some of our competitors is we do extra imaging. So when you come and get a scan here, you're in the scanner for longer, but you get more views, more sequences, with higher detail. So the scans that we do are thinner section. So some places do 4 millimeters or 5 millimeters or even 6 millimeters thickness slices. A lot of times, I mean, it depends on the scan, but in some cases we're doing 2 millimeter thickness slices, which means basically like if you're looking at the lens of a camera, the lens is better and clearer. So we do very thin, and it allows us to pick up, particularly in neuroimaging, but all other imaging as well, pathology, more pathology. And we do, for example, if you come in to have a knee MRI and you're worried about an ACL tear, we do a special sequence that I don't think other people do, where it's an oblique view through right where the anterior cruciate ligament is in the knee.
Those are big words.
ACL.
ACL.
Everybody knows ACL.
It's the largest ACL. It's the largest ligament in the knee. But we do a special view right through it so that we can diagnose a tear. With the shoulders, we do this view called the Aber view, and it's where the patient has to extend in the magnet in a certain way, but allows us to look at the labrum better. And that's an imaging. That's something that, as far as I know, is only really done consistently at SimonMed. For spine imaging, we do this sequence, which is a sequence which brings out edema. It's called a stir sequence. So it brings out if there's swelling in the muscles or in the bone, and it's an extra sequence, and we do it just to try to help the patients. And to go along with, and we also with the brain, we use these software programs, as Maurice was saying, called Neuro Quant and Lesion Quant. And Neuro Quant is a program which is a volumetric analysis of the brain. So we do a brain scan. MRI means we scan the brain, and then the program, it measures multiple areas of volumes throughout the brain. So it measures the volumes of different areas in the brain. And it's very valuable to assess for volume loss in areas. So patients with, particularly we use it for Alzheimer's disease. And in Alzheimer's disease, an area in the back of the brain will become smaller in some patients than in normal patients. And so we can suggest if the volumetric software detects that they potentially have Alzheimer's, or alert the clinicians to the possibility. The hippocampus is another area of the brain that we see in head trauma and in other areas that is decreased. So if we can measure that, it gives us a little more sensitivity to diagnose diseases. And Lesion Quant is a software program which picks up little, if you want to call them white dots that people have in the brain. And you can get them from aging, you can get them from multiple sclerosis, MS, you can get them from a bunch of conditions. And this program will document those dots, and it'll say how many there are, it'll say the volume. It's very exciting stuff, and it's those programs we're doing research on as well. And I think it adds more to patient care, and it aids us in diagnosing conditions.
It's very technological.
Did I say it correctly?
Yeah, no, that's great. I love getting that education, and I think I saw a video that really defined the importance of technology to SimonMed. So, Nick, if you could spin up that video, that would be great.
I'm really happy to be working for a company that has the technology to save people.
It's important for our staff to understand, to have great technology. We have to utilize it and be very efficient.
I think we are probably one of the most efficiently ran radiology companies around.
I think that SimonMed upholds its mission because it's very committed to providing top-of-the-line technology.
State-of-the-art technology, we're always upgrading.
Training is a must, and keeping all staff trained on the new technologies that's coming out.
I believe that SimonMed upholds their mission by always striving to be the best in class. I feel like as an organization, we're always asking ourselves what we can do better to be a superior company for our patients and our employees.
Great video again. So Parkinson's is really, unfortunately, it's growing. It's out there. You mentioned earlier DAT scan and DAT quant. Dr. Snyder, what does that do with treating or the beneficial exam for Parkinson's? How does that correlate?
So a DAT scan, if there's a concern for Parkinson's, if your doctor has a concern, we'll get a nuclear medicine scan called a DAT scan, where we inject some radioisotopes which attach to an area in the brain where becomes damaged in Parkinson's. And so we offer the scan, and then we have this software program that looks at how it's binding, and it compares that to other age match controls. And so it's one thing for the radiologist to look at it subjectively, as I do every day, and you say, yeah, it's decreased or it's increased. The software program gives sort of more exact numbers, and occasionally it can sway you one way or another in making the diagnosis. So it's very helpful. I believe we're the only place in town that has that software program, and I do find it helpful to assist clinicians in diagnosing Parkinson's.
And then two other big words that you used that I want to get clarity on. So you brought up neuroquant and lesion quant. What are the benefits of those?
So lesion quant we use for a lot of things, but a lot of for multiple sclerosis, and then we can see if the lesions are changing over time. So the program will tell you on the previous scan, this patient had 10 lesions. On the current scan, they have 14 lesions. And the radiologist also, you have to go and look yourself, obviously, to make sure the program is correct, but it can sort of aid in that. And then the neuroquant, it looks for, as we talked about, the volumes of the areas, different areas of the brain. It looks at over 50 regions of the brain to assess for volume loss. And depending on the symptoms of the patient, that can be helpful. And those are just a few. There's so many more advanced imaging, especially in neuro, that we do. I mean, we have patients that fly in from all over the country for our advanced imaging protocols. We do perfusion using MRI. We use spectroscopy, which is looking at metabolites in the brain. It's kind of an advanced imaging. We use diffuser tensor tracking, which looks at the fiber tracks. So the brain is made up of all these telephone wires, and we can get a 3D image of all these telephone wires using diffusion tensor tracking, so we can see if there's problems with that. We use a susceptibility weighted sequence, which is for hemorrhage, which is an advanced sequence, which takes a long time to run. It's an expensive sequence, but we run it on patients with trauma or with other conditions with strokes. We run that one. So for neuroimaging, there's lots of extra sequences that we do. We work with neurosurgeons with functional fMRI, and functional fMRI is where areas of the brain light up if you're doing a task such as auditory or visual, and we can document what areas of the brain are functioning, and then the neurosurgeons, when they operate, they can avoid those areas, so they can plan their surgical approach based on the functional MRI imaging. And we work with neurosurgeons in town to do that. So it's pretty exciting.
It's music to my ears when I hear that you're bringing patients in for care. As you know, Las Vegas Heals is deeply engaged in this effort to position Vegas to become a globally recognized destination for health and welfare, or health and benefits. So we're trying to get patients to travel to Las Vegas. So knowing that you're attracting patients here is awesome. So that's great. And a big part of that is research. And you do quite a bit of research at SimonMed. Tell us a little bit more about that.
Well, yeah, so we on most of our research is focused on traumatic brain injury, and we have about 350 patients. We have an IRB through Toro, and a lot of the students, we have students from other medical schools that are helping us too. We have statisticians that have done a lot of work, and we're hopefully we'll be publishing some of the largest series on some of these advanced imaging that we talked about, like the diffuser tensor tracking, the neuroquant. There's a lot of other there's been publications on these traumatic brain injury, but not in the numbers that we have. So we're hopeful that it will be groundbreaking. And a lot of this was started by Dr. Orson, who unfortunately passed away, but he was a big proponent of this research, and he established many of these protocols here in Vegas along with Dr. Simon.
So it seems like there's a very well thought out vision of where you're heading in Las Vegas with SimonMed. Maurice, tell us, what does that look like?
Just to piggyback a little bit off on what Dr. Snyder was saying, a lot of the stuff that we do at SimonMed, the neuroquant, DAT quant, the lesion quant, there's no extra cost to patients. So bringing that to Las Vegas for patients that are really in need of these types of exams, and I would really like definitive results. So these aids are no extra cost to our patients, so it's important that we have that. What we're bringing to Las Vegas is the quality of care. Making sure that the patient experience is the number one thing that we focus on. And not only that, whatever advanced radiology techniques or exams, we want to bring it here. Like you said, we want people to come to Las Vegas to say, hey, I want to go to Las Vegas for my care. Too much I hear now, people are going outside of Las Vegas. we want to change that. And SimonMed is a big proponent in making sure that we keep our patients here and bring other patients here too as well.
Well, I think you're bringing in the technology.
Yeah.
You're clearly bringing in the talent to do just that. So kudos to you all for all of that. And SimonMed operates on an acronym called CARE. And I think we have a video that probably speaks to that best. Nick, if you could cue up that video and play that video on CARE, that would be awesome.
Having communication, accountability, responsiveness, and excellence is really important. I have to have a good balance of all those to be successful in my job role.
We have to be responsive.
Making sure that we're getting everything to the doctor's offices on time.
It's really important to be able to listen to them and respond and make sure that they're comfortable and they receive the proper care.
So communication in my field is number one.
As our company grows, it's vital that we learn to communicate better and develop those lines of communication.
I think without excellence, the other values can't really be all they can be, whether we're being the best today, tomorrow, or just changing what we do to always looking forward to becoming better and better.
The most important value to me is accountability, and I think that goes for our patients as well as our co-workers and employees.
We want a great work ethic so people feel important and appreciated, and they'll produce great quality work. And that they can handle the complicated work that we do and these increased expectations.
Wow. Another great video.
You can see Maurice is famous on national level too.
Very good. Well, guys, we've covered a lot of ground here today. We've talked a lot about SimonMed, the great things that are happening, your working relationship with Toro, the research that's going on. Is there anything that we didn't cover that you want our viewers to know about?
I think from this entire Inside Medical Medicine segment, I think the most important thing I want our patients to know is that we care. And we want to make sure that they have a good experience here. By no means are we saying we're the perfect company. We strive to be. So if there are any other questions or concerns, patients can always contact me directly. Ask for Maurice Maharaj, and I'll be there for them. If there are any issues or concerns, or if they just want to give us a kudos, please, by all means, reach out to us. We are part of the community, and we want to interject that into not only our culture at SimonMed, but the culture here within Las Vegas is that we appreciate our patients and the referring providers. So any patient could get on www.simonmed.com and look up all the information for SimonMed and be able to schedule appointments online, give us a call. That's one of the most important things, I think, out of this segment.
Doc, did we miss anything?
I think we covered it.
Okay, very good. And those viewers that are with us today that are in the industry and want to come out and meet the folks from SimonMed, we are holding a healthcare happy hour up at their facility in the Northwest, and that will be on Thursday the 19th, 5:30 to 7:30. So go on to LasVegasHeals.org, and you will be able to find that. For those of you joining today, thank you very much, and we look forward to seeing you next week on another edition of Inside Medicine. Gentlemen, thanks for joining us today.
Thanks for having us.
Thanks, Doug.
Y'all have a great day.
Thank you.